joining us for more as the new entry in the race for the virus and talking about the vaccine now for COVID-19. In the studio here is Mr. Ayodele Shubowale. He's a pharmacist with the National Orthopedic Hospital, Igbobi, Lagos. Welcome to the program.
I'm happy to be here.
All right. We see that scientists are increasingly optimistic that a vaccine can be produced in record time, as a matter of fact, but getting it manufactured and distributed might pose the biggest challenge. But looking at the role of pharmacists, what role do you think that they play, or what do we know that the Pharmaceutical Society is working on with regards to vaccines or a search for a solution to COVID-19 in Nigeria?
Well, thank you for this question. Let me just say that vaccines are pharmaceuticals, so they fall under the purview of pharmacists. So pharmaceutical companies are involved in the development, of vaccines. These pharmaceutical companies have pharmacists working with them at every stage of the vaccine production. They're involved, right from the making of antigens, separation of antigens, formulation of the vaccines themselves. Then when vaccines are eventually given the go-ahead to be put on the market, pharmacists are still involved in post-marketing surveillance. This is done to ascertain the safety of these vaccines. So pharmacists are involved at every stage of the making of vaccines. In Nigeria, we have pharmaceutical companies that are collaborating with their parent companies abroad, so in the formulation of these vaccines. So pharmacists are very much involved. And the PCN, PCN, if you understand, is a body of pharmacists. It represents pharmacists. They are not actually involved, but they facilitate, for companies who want to produce vaccines, they facilitate their making of these vaccines, because they connect them to government. They make government to know their plight. So where they need to be funded, they present their case to government.
All right. We hear that our correspondent, Mary Alale Yusuf, joins us now. She's reporting from Alausa here in Lagos. Mary, can you tell us what's happening? Status report, seeing as the NMA in the state have reversed their sit-at-home order.
Yes, the NMA, thank you so much, Millicent. The NMA has reversed the sit-at-home order, and they're asking doctors to go back to work at 6 p.m. today. But this is a cautious directive. They're going to be looking, they say, because they said this is not the first time this is happening, and it's really embarrassing. So they will not hesitate to go in there and save, or should I say deliver, any member of their society if anything goes untoward. But for now, the directive has been reversed and doctors are allowed to go back to work. We're expecting the Commissioner for Health any moment now. And of course, there are questions in people's minds with Lagos having 2,954 cases. It's 44% of the burden in Nigeria. That's a whole lot. So we'll be asking them about available bed spaces. We'll want to know the distribution of cases in local government areas as well. And then we'd like to also know about the projection of 120,000 by July. How exactly are we going to handle this progression in Lagos? Millicent?
We appreciate your time. Thank you so much, Mary. We'll try to touch base with you later on in our programs. Finally, to you, Pharmacist Shubowale, the use of chloroquine. NAFDAC has said that clinical trials, they've approved that for chloroquine. But what do you make of it and its treatment for COVID-19?
Well, I think chloroquine is very relevant in the management of COVID-19. If we look at the pathophysiology of COVID-19, autoimmune is a very prominent feature, whereby the immune system turns on the organs of the body. They destroy organs in the body, especially the lungs. But chloroquine, if we look at the properties of chloroquine, right from in the 40s, chloroquine has been used in the management of autoimmune disorders, lupus, then rheumatoid arthritis, which is an autoimmune condition.
So you would say there's promise?
Yes, exactly. Chloroquine has a place in the management of COVID.
Okay, we'd like to. All right, we'd like to appreciate your time. Definitely, you join us again, talk about this race for vaccines. Mr. Ayodele Shobowale, a pharmacist with the National Orthopedic Hospital in Lagos. Thank you for joining us.
Thanks for having me.